The Noguchi Memorial Institute has since 2009 not received government funding for research. It therefore depends on donor partners who only give support for research they are interested in. The center has over the years been involved in some novelty investigations, including discovering the HIV/AIDS virus and a vaccine for children below 5, preventing diarrhea. Odelia and Tiamo spent a day at the center looking at the business of science research.
We're currently at the Noguchi Vestergaard Lavi Lab, and we're actually talking about a subject matter that is not really palatable, and I'm sure a lot of you do not like mosquitoes, but well, right here, my colleague is already getting goosebumps, but right here are mosquitoes that are being reared, and then, well, tests will be run on them and results sent to the company called Vestergaard. And what they do is to produce mosquito-treated nets. So mosquito-treated nets don't just pop up. They will have to go through processes, and this is what Noguchi does. From larva to the matured mosquito, Noguchi scientists grow the mosquitoes for companies who want to develop different products for the prevention of malaria. Currently, research into different mosquito-treated nets by the world's leading manufacturer, Vestergaard. The company, through the Malaria Control Board, and Noguchi have developed mosquito nets to counter mosquitoes that have grown resistant to their current nets in certain parts of the country.
This company is the largest producer of insecticide-treated nets. That's the Permanet 2 and Permanet 3. There are areas where they've discovered resistance, and in such places they do management. Like there's management that they do. So the malaria control program, for instance, if they find out, like for instance, that the nets for a particular insecticide is not working in an area, Vestergaard recently has developed a one with PBU, something called PBU, a synergist. That is, it's not an insecticide, but then it increases the toxicity of an insecticide. So it's a synergist insecticide impregnated nets. So in an area where you have that particular insecticide being resistant, the presence of the synergist kind of increases the toxicity of the insecticide in the net and helps control resistance.
Based on this information, it's clear this part of the organization is virtually controlled by a foreign investor who benefits greatly from the center. For example, mosquitoes found in Ghana are not the same as those found in Vietnam, where Vestergaard does its production of mosquito-treated nets. So the Ghana lab at Noguchi is extremely important to the company. It means that if the department were to be solely manned by the government of Ghana, mosquito-treated nets could have been produced for the rest of the continent, perhaps a place that government should turn its attention to concerning the one district, one factory. This is the general norm at the Noguchi Memorial Institute, as every department virtually depends on funding sources outside, which skews the research interest. Dr. Evelyn Yaira Boni at the Virology Department has been researching into HIV/AIDS for years and fears this is setting the nation back.
What I would say is that sometimes the priorities are different. For instance, well, we have to keep going back to funding. So what we need as a nation, maybe I need to do that research, but the person funding the research is an external organization, and their priority is different from the priorities here. And so I would do more of what I'm getting money to do and less of what sometimes is important for us as a nation, but because there's no national funding, I cannot do. You get it? So there are results that we have, and sometimes you push it to the implementers. They have these results, but they say for us to take what you are saying into policy, we need funding. And again, the funder of the implementation side is not interested.
She adds HIV patients easily grow resistant to drugs, and the need for frequent research on patients to know their level of resistance, hence the right drugs prescribed, has been relegated to the back.
As a nation, we are not doing so much on HIV drug resistance. One, because we don't have the funds to monitor the individual patients to see what is happening as they take the drugs with resistant testing assays. We have other assays that we use, and those do not give us enough information on what the virus is actually doing. You see a viral load that has gone down, yes, that is good. But even with low viremia, when the viral load is low, once the virus is still there, is multiplying, it will rather now bring forth the resistance ones. Now, one of the frustrations, or I don't want to call it frustration, one of the issues that is coming up is now we need to, as a nation, do surveys in our population to see what is happening here in Ghana, because there's subtypes of the virus. We know we have HIV-1 and HIV-2, but they have subtypes, and the ones that circulate here in our sub-region is quite different from what is in South Africa. It's quite different from what is in the Europes and the Americas. And so if we just keep taking what they say and implement it without really looking at the problem on the ground, we will get to a point where the situation will overwhelm us.
Head of Virology, Professor William Kwabena Ampofo, says since 2009, Noguchi has not received any funding for research from government.
Health. I mean, the last time we did get support from the Ministry of Health, Ghana Health Service, was in 2010, when we had the swine flu, scare. I think last year you heard about the Kumaka, issue where we found the flu in some of the students, and that has emphasized our need for a regular budget from the from government. But recently we did have a visit from the Minister of Finance, and he's reassured us that public health, and especially the Noguchi Memorial Institute for Medical Research, will be a priority, for support from government. So with the recent Ebola with the recent declaration of Ebola in DRC, we hope that this will not be a scare, but will be a reminder, that we really need to support public health preparedness with resources pre-positioned before the outbreaks are declared, because it's really very difficult to do procurement and bring in supplies when there is a global alert. Then everybody is scrambling for reagents and supplies from the same manufacturers, and it's difficult to get.
After babies did not really get cured from vaccines meant to cure them from diarrhea, the electron microscopy department developed a rotavirus vaccine, a cost-effective intervention which has saved a lot of children, as between 50 to 100 children die every year from diarrhea until the intervention in 2012.
We tested a couple of the rotavirus vaccines to be sure that they were producing the desired effect in Ghanaian children. And based on this, recommendations were made. And in 2012, finally, Ghana introduced the rotavirus vaccine in Ghana. And since then, we've seen a drastic reduction, not only in the number of diarrhea cases, but also the number of diarrhea hospitalizations. I think we're looking at the region of about 49% drop. So that's pretty significant. Ghana Health Service, Ministry of Health was in the know of what we were doing, and of course eventually there's this organization called Gavi that provides the first 5 years of support for countries that are eligible. So essentially they've been paying for the vaccines that we've been using since 2012, and that's just about ending. But because government has to take up the bill after that, because the vaccine is part of the EPI now, so it's accessible across the country, but government has to take up that bill now. So of course it required showing the evidence to those who take the decisions and letting them be convinced that this is a problem to spend some of.
From the development of disease-resistant drugs for malaria to tuberculosis, it's obvious Noguchi could be an asset to the country for medical industrialization through research.
I must say that in this department we are also working on vaccines or looking at antigens or proteins that we can use as vaccines for children. Okay, we're working with groups in the US and also in Europe to try to see which portions of the parasite you can also take, just like the development for pregnant women now, also looking for those antigens that can be used as vaccines specifically for children.
This lab is the only polio lab in the country. So this is the National Polio Lab, and we are also designated as WHO Regional Reference Lab for Africa. But in terms of national lab, we don't receive any funding from the government. So all our activities have been funded by WHO.
The National Tuberculosis Program has gone to some other regions in Ghana, and they found out that what we are reporting to the WHO is underestimation. In 2012, they had a prevalence survey, which we led. Noguchi led that prevalence survey, and we saw that our prevalence rates that over the years we've been reporting to WHO is actually underestimated. What we found was 3 times what was reported by WHO. So initially WHO had put us at a very low burden TB country, but now we are up there with those who are reporting high burden TB cases.
The center, since its inception in 1979, has been funded by the Japanese government since it was named after a scientist called Noguchi, who died in 1928.